Hi, my name's Callie. I am joined here by Dr. Jim Vitale. He is a doctor of acupuncture who has been practicing for over 25 years. He has studied in Japan, completed his nutrition studies through Harvard, and has been teaching at the New York College of Health Professions for more than 20 years. He's also a certified laser therapist and was recently recognized with a Healthcare Heroes Award for his innovative laser treatments and fertility care. Please welcome him.
Hi, thank you, Callie, for having me. I appreciate it.
I'm glad to be here with you. So today we're going to talk all things fertility. We're going to talk about how we got into acupuncture and how that benefits IVF treatments and fertility outcomes. So when did you first become interested in acupuncture? What drew you to the field?
So it was by accident, actually. So when I was in my early 20s, I decided to change careers and just move to Japan. And I lived in Japan for several years. My goal was to study the culture, study the language. I was teaching English and study martial arts, and which I did. And while studying martial arts, I hurt my back. And so during that time, my sensei said, well, you should try acupuncture. And at first, as being a young man, I'm like, oh, no, no, thank you. That's voodoo. I don't want to be stuck with needles. And he convinced me, he says, just try it. And so I did, and I fell in love with it. I couldn't believe how good I felt after just one acupuncture session. I thought I can do backflips out of the place. And so that really just planted a seed in my brain. This is something I would love to learn. So I studied as much as I can while I was in Japan. Then when I came back to the United States, I formally enrolled in school, and the rest is history.
So you started your training initially in Japan, and was it formal or just like a very
It was
informal?
informal training then because I couldn't read or write Japanese. I could speak Japanese, but
Okay.
I wasn't proficient enough to enter the university system there to study at that time. So I was informally training under a few different people. And then when I came back to the States, I got my formal degree, my master's, and ultimately my doctorate. But then I've been back to Japan several times to study in Kyoto at Meiji University Hospital, where I did a couple of rounds there in their hospital, which was an amazing experience.
Wow, that must have been so incredible.
Oh yeah, Kyoto. Japan is such a beautiful country. I consider that my second home, and I can't wait to go back again. I'm way overdue for a trip.
I will have to pick your brain. My husband and I were just adding Japan onto our travel wish list. So,
Absolutely have to do it. It's beautiful.
yeah, that's what we hear. So, since you have been teaching for over 20 years, when did you like get into it after you felt established in your career? You started saying, I want to help others learn the skill and
So after graduating school and starting my practice, my mentor was a teacher at the school. He was my mentor. He was my teacher, and he decided to leave that school. And there was an opening. And after 5 years of private practice, they'll allow you to teach. And he suggested is you should really go back to teaching because it really reinforces the information. And
yeah.
I've always been drawn to teaching. I taught martial arts for many years, and I've taught other things. So teaching is a second love of mine. And so it was natural to go back to teaching, and I love it. I really love teaching. I love mentoring and bringing up the next generation of
Okay.
practitioners.
Have you noticed that like acupuncture and like integrative medicine has evolved in your like time, like in your career and your teaching experience?
Yeah, it has gained a lot more acceptance in the general public since I started. And I started in '01. And back then, when you said you were an acupuncturist, people looked at you funny, saying, oh, that's wacky. But now, since Oprah, Dr. Oz, and everybody's doing acupuncture, it's much more mainstream now. So it's nice to see the acceptance because it's over 3,000-year-old medicine.
Yeah.
For a long time.
Yes. I completely agree. I myself have had acupuncture. You were my doctor, so I totally support the treatment modalities, and I think it does make a big difference. So, since you've been studying acupuncture, what made you go into fertility specifically with that training?
So that was also by accident. I didn't intend on being a fertility specialist when I was in school. I was trained as a general practitioner and with an emphasis on sports medicine because that was my interest at the time. But I was also recently married when I graduated. So my wife and I got married soon after I graduated school. and started practice. And after getting married, we decided, hey, they're not getting any younger. Let's start trying. And we ran into some problems. She was told that she had a blocked fallopian tube. We were both devastated. We were like, oh, what does this mean? And let's see what we can do. So before we resorted to any medical interventions, I went back to the books. I consulted with some herbal teachers I've had and some of my old teachers, and started studying about more fertility and specifically fallopian tube. And we tried many different therapies. We were doing acupuncture with electricity. We were doing herbal therapies. We were doing massage. And 3 months later, she was pregnant naturally. She didn't go back for another scan because we were figured, let's give it some time. And it just happened on its own. So we were very happy. And my son is actually my first success story, which was great. Now 22 and just graduated college. I can't believe that.
Wow.
So, yeah. So he's my first success story. And since then, the universe decided that's going to be my area of expertise because I've gotten so many people come to me since then.
Right.
Wow. Fertility. And so the universe provides when you're ready for it. And so that kind of drew me into fertility. And just being able to make such a great difference in someone's life is such a fantastic thing. So
yeah, for like that piece of somebody's life is absolutely life-changing. I can speak to that. I saw you for my treatments surrounding my fertility, and I think we both have helped so many women, like in my short time working with you. So it's definitely incredible. But since you have been practicing, I'm not going to say for so long because we're still young, but why do you think we're seeing so many fertility challenges today more than we did? I'd say, yes, your son's 22, so obviously challenges existed then, but I feel like it's definitely so prevalent or spoken about in the last few years.
It really has gotten worse, not better, which when I first started, I anticipated eventually they're going to figure it out and it's going to be a thing of the past or it's going to get better. And it's just got progressively worse and worse. And which surprises me and dismays me because there's so many factors that play into infertility. Infertility has been, or the infertility rates have been steadily declining for the last 30, 40 years. Along with testosterone rates have dropped. Just fertility rates in general have consistently dropped over the years. And even though modern science is making great progress, it's not translating into better health. And so I think age is just a small piece of the puzzle of the problem. Oftentimes I'll get couples coming to me saying, oh, we're 36, 37, 38, 40, we're too old. And it's age is only a small piece of that. It's so many other factors. I find one, environmental toxins. So environmental toxins are probably one of the biggest causes of the problem. Because now with all the rage about microplastics, we hear about microplastics being found in every part of the body. Microplastics are being found in the brain, in the testicles, in the ovaries. So the exposure to these microplastics, which is everywhere, is a serious contributor to the fertility challenges. There's one of the storms of the perfect storm of infertility. Nutrition has seriously degraded in the last 20, 30 years to just highly processed foods, bad ingredients, seed oils, and the sciences of nutrition have unfortunately been bastardized by big pharma, big food, and suppressed science. Seed oils, which we were told were healthy for the longest time, and now it turns out they're not. They're highly inflammatory. And so there's been a breakdown of the food system that contribute to this perfect storm. So it's another storm. I would say environmental toxins, breakdown of our food system, and age all combine to create this storm of infertility.
What about like lifestyle factors or stress?
Stress too. So yeah, absolutely. Stress is a huge player in this. And it's one of those things that the more you think about, the more it gets worse. The bigger the monster gets, the more you think about it. So yeah, stress from not just from yourself thinking, oh my God, it's not working, but social media, I think, has really added fuel to that fire because we see the world through social media lens that we compare ourselves to everybody else who's got perfect lives on Instagram. And that just adds more fuel to the fire. So stress absolutely is a huge role.
Yeah, and I feel like sometimes there's almost, I don't know if it's being studied yet, but like informally, I do feel like certain occupations almost add that because of the nature of the stressful job that they're doing. We're seeing a lot of people struggle there.
Yeah, definitely. Definitely.
Yeah.
Yeah. Over scheduled
Mm,
lives. Every second of the day is scheduled and there's no time to breathe
guilty.
and to be, right? Yeah.
Yeah.
No time to just be at peace with yourself and be at peace with nature. Yeah.
Yes, I know. I tell people I'm like just disconnect. Like I have learned like I Thursdays I leave completely open for myself usually, with today being an exception. But yeah, I usually try not to schedule anything and the day will just go as it's supposed to go. It's nice and relaxed.
You need that.
Uh
Self-care is not selfish.
no,
Self-care is selfless because the more you can do for yourself, the more energy you have to give to others.
absolutely, absolutely. So what would you say like you see what are some of the biggest gaps in the current fertility treatment model?
So I think my personal opinion about that is I wish if I had a magic wand, I would love to change the system on how a couple approaches their fertility treatments or fertility
Okay.
life. Right now, as you very well know, when a couple starts to decide they want to try and it hasn't happened in the time allotted, whether it's a few months or whatever. So right now they go to the OBGYN and the OBGYN says, well, if you're in this certain age bracket, try for a year, doesn't work, come back, then we'll test. And then we'll put you on Clomid. And if the Clomid doesn't work, then we'll send you to an RE and they'll do an IUI,
Mm,
3 rounds of IUI, then they'll send you off for IVF. So there's a big breakdown there because they're missing out on testing earlier and changing lifestyle. So if I had a magic wand, I would say, okay, yes, if you haven't gotten pregnant in 6 months or so of trying, go see your OB, but then also go see a functional medicine doctor or someone who's trained in acupuncturist like myself, who's trained in nutrition and lifestyle and everything else, and get the testing done sooner than later. Don't wait. Get fallopian tube, the HSG test done, get a water sono done, get your hormones checked, but also get your diet looked at, change your exercise routine, and take a functional medicine approach first. So you may be able to prevent that IUI or IVF because if you can get your body healthier from the get-go, and it takes a good at least 3 to 6 months to make significant changes to your health,
right.
minimum of 3, it's more like 6 months to a year to make significant changes to egg quality and to sperm quality and to overall health factors. That if you were to do that, I would say 30% of the cases could be prevented of going to IVF or IUI.
But as you mentioned earlier, you spoke briefly on that big pharma component of things. Changing lifestyle doesn't make money. And a lot of this is also dictated by insurance companies where you might have a very excellent OBGYN who does know that but this patient should get testing done, right? But insurance says, well, if it's not documented, they've been trying for this long, they're not going to cover it. And so then there's that financial piece. But I also hear a lot from patients that they just don't feel seen as a whole person, whether they're going to their OB or they're already established with a reproductive endocrinologist, where I think you bring to the table seeing them as a whole, just like a functional medicine provider, and even myself when I coach women. So I think it's definitely what drives people to look for these complementary they're trying to conceive.
It's an unfortunate complaint about our entire medical system, not just
Yeah.
the fertility world, but you speak to anybody who's looking at a chronic or acute illness. And again, it's just a breakdown of that system where the doctor, and I don't blame the doctors, they're in a system that's broken and
Yeah.
they're good people with good hearts who want to heal. But unfortunately, they only have 6 minutes to spend with somebody. And
And
it's
then
much easier to write a prescription than to educate them and to work with them on a more personal basis. So the whole system is unfortunately broken in that respect. And so it's up to the patient, it's up to ourselves to really advocate for ourselves and be proactive and not just listen to the white coat.
absolutely. Absolutely. So I did want to follow up with that is for someone who's never tried acupuncture, how does it help fertility? You shared that your son was your patient zero, basically, and your first success story, but does it work differently for someone trying naturally versus someone who's going the IVF direction? Can you give us a little bit more explanation behind that?
Sure, absolutely. So acupuncture it is, and Chinese medicine in general is the umbrella term for what we do, Chinese medicine. Acupuncture is the insertion of very tiny, very thin needles into certain points on the body that basically have several beneficial effects on the body, especially for fertility. One of the things that it does when acupuncture is done correctly is that it relaxes your entire nervous system. What it does when you put a needle in very gently, your nervous system flips from fight or flight into rest and digest mode, from sympathetic dominance, like your body's being chased by a saber-toothed tiger, and puts you into rest and digest, or what we call feed and breathe. Because when your body's being chased by a saber-toothed tiger, the last thing you want to do is reproduce and digest food. So your body shuts down those systems while you think you're being attacked. Acupuncture puts your body into that deep, relaxed state and brings down adrenaline, brings down cortisol, and allows your body to recompose and do what it's supposed to do. So acupuncture is wonderful for relaxation, but not only that. But when it comes to fertility, it also helps with blood flow. So studies have shown that when acupuncture is done on the abdomen and certain points on the body, it improves blood flow specifically to the uterus. So you have a better, thicker uterine lining that's more receptive for implantation. And it also improves blood flow to the ovaries. And so it makes the ovaries more responsive. And then finally, the third benefit of acupuncture for fertility is hormone balance. So there are points that we can use to stimulate the hypothalamus, the pituitary, and reestablish that HPO connection, that hypothalamus pituitary ovarian axis that is responsible for a healthy cycle and healthy fertility. So those are some of the main benefits that acupuncture has on the body in general and specifically for fertility. Now, whether someone's trying naturally or IVF, we just change up the points depending on what's happening in that day or where they are in their cycle for that week. But the treatment is similar, very simple.
Okay. And now do you find that you're working with women like of course you're going to see people going through IVF, IUI, natural, like the whole scope. But do you work with specifics like endometriosis patients or women struggling with diminished ovarian reserve, maybe recurrent pregnancy loss or male factor even? Like how does you tailor the treatments for those specific things as well?
Absolutely. Yeah. So we do see across the board PCOS or PMOS now that it's called, which
PMOS,
is
yes.
terminology. So PCOS, PMOS, that and endometriosis is it's crazy how much more prevalent it has become in the last few years. I'm seeing much more cases of that. And that's a very complicated, difficult case to treat. But acupuncture can help with the side effects or with the pain and discomfort. I
Sure.
wish
But it's
acupuncture,
kind of just like masking the real problem in a way.
it's symptomatic maintenance. It's not fixing it. It's
Yeah.
that's only surgery or is the only thing that can really help. But if someone has heavy painful periods, acupuncture can help decrease the pain and discomfort.
Sure.
Yeah.
Sure. And then I guess like I know this might be a question that's outside of like fertility focused medicine, but say someone conceived, they have their miracle, but they want to continue on with acupuncture and they have that underlying diagnosis of endometriosis. Could you potentially use points that maybe could kind of suppress that endocrine your estrogen a little bit? So because estrogen feeds endometriosis is what we know. So maybe we kind of suppress a little so it's not feeding it and growing back as fast. Is that a possibility?
So with the acupuncture has more of a regulatory effect, not a suppressing effect.
Yeah.
So if it's a matter of estrogen creating, acupuncture won't
Okay.
specifically reduce that estrogen.
I
What it
see.
will do, it will reduce the pain receptors.
Okay.
So you're not in so much as intense pain. It'll
But
help you
there's
to,
no way to necessarily slow down the recurrence of endo again. Is it? Oh,
yeah, yeah.
we
Chinese
have to figure
herbs,
that out for these ladies.
I know. In Chinese herbology, there are herbal protocols. Like a master herbalist can use herbal protocols over the long course to help reduce all of that sensitivity. But again, nothing has been shown to be long-term curative. It's just symptomatic maintenance.
Understood. Now, when would you say is like an ideal time for someone to start acupuncture? And I know it could change based on what they're going through. And you mentioned already that any lifestyle, any changes or additional modalities, at least 3 months you want to give it. But what would be a good time for someone to start?
So how is now a good time?
Mhm.
The old Chinese saying is the best time to plant a tree was 20 years ago. The second best time is today. So there's no bad time to start acupuncture. The sooner the better. But so in a perfect world, I'd love to get somebody at minimum 3 months out of a procedure. But ideally, if someone's on their journey, just started their journey, they're a younger couple who just got married, they're just starting to plan. I'd love to get them in at some early on so I can really counsel them on lifestyle and diet and exercise
Mhm.
and everything else. So when they're ready, it's a smooth transition into pregnancy. But very rare, or I don't often get them. I get them when they've already had 2 failed transfers. And yeah, the time frame really is whenever they can get in. The sooner they can get in, the better,
Sure.
because you're going to get that accumulated benefit. But if someone has an IVF transfer, day of alone. So if someone had never done acupuncture ever and they're having an IVF transfer, just doing acupuncture on the day of IVF transfer, just before and right after. So studies have shown that doing just 2 sessions, one just before and one right after within a 24-hour window, can improve the success rates of implantation by 30%.
Amazing.
So yeah, that alone is just wow. The ASRM has acknowledged that. So the American Society of Reproductive Medicine has endorsed acupuncture as a great therapy to help with
Successful
IVF,
transfers.
the successful transfers. And many clinics around the country are now incorporating IVF acupuncture in-house, pre and post. In
Right.
fact, for many years, I used to be Long Island IVF before they merged with RMA under Dr. Kreiner. I was his on-call acupuncturist in-house in Melville. So I used to go there. I was on call. I used to go there and do acupuncture in their recovery room before and after a transfer. And the success rates were significantly higher.
It's amazing. And now, since you have been recognized for an award, what are some other when it comes to lasers? Do you offer that in your office, right? So, tell me a little bit more about the other services that you're offering that are fertility focused.
So yeah, besides just acupuncture alone is powerful, but not enough. It's to really make significant improvements in someone's health. You have to take a holistic approach. And we look at everything. So I do dietary counseling, nutritional supplements, herbal therapies, but we also offer fertility massage. So we have a massage therapist that studied fertility massage, similar to the Arvigo Mayan uterine massage or the Mercier therapy. There's many different therapies. That's a physical manipulation, manual manipulation on the abdomen that basically goes in deep tissue and breaks up adhesions, moves fluid, flushes the tubes, flushes basically any kind of scar tissue and adhesions in the lower abdomen. So our massage therapist does that. She does a fertility massage, which is usually recommended once a month in the window when the period is over up until about ovulation. That's the ideal time to do a fertility massage.
Okay.
You don't want to do it during the period because it's uncomfortable. And after ovulation, just in case, we don't want to interfere with any implantation. So we
Understood.
do offer fertility massage. And we also offer photobiomodulation or laser therapy.
Okay.
Laser therapy is very exciting recent development in the fertility world because laser or red light LED therapy, they all fall under the same umbrella. And what it is, laser therapy is red lights at a very specific wavelength that have been shown to improve blood flow, but more importantly, improve mitochondria. If you remember back to high school science, mitochondria is what the powerhouse of your cells. So you have your cell and you've got this little organelle in there that actually makes energy, ATP. And the right wavelength of laser, it stimulates and improves their cells' function or ability to make energy. And that's what causes aging, is that slowing down of that energy production. So we can stimulate the body with these lasers, stimulate specifically right over the ovaries to produce to stimulate the mitochondria to basically turn back the clock and get them to rejuvenate.
Who is a candidate for these type of lasers?
So the laser therapy works best when in cases when somebody has beginnings of diminished ovarian reserve or low high FSH. Those have gotten the best results. If someone's on the younger side and they don't have ovarian or egg issues, then laser's nice, but it doesn't have a huge benefit. It's really for the ones who have a little lower AMH, higher FSH, because we're rejuvenating those mitochondria.
And is the laser also used for transfers or just for prior to egg retrievals or natural conception?
So the packages the protocols that we do a 3-month egg rejuvenation protocol, minimum 3 months. Sometimes it takes 6, but 3 months of 3 times a week for 2 weeks leading up to ovulation. And over the course of 3 months, going back to science, the egg maturation time is about 90 days, just approximately 90 days. So the eggs that were predetermined to come out now were determined 90 days ago to be the dominant follicles. So when we start laser treatment now, the eggs that are coming out in 90 days will be the ones to show the most benefit. So you have a 90-day window for that.
But somebody needs to be ovulating in order for this protocol to be in place, right? What if they're anovulatory?
So if they're anovulatory, the ovaries are still getting the benefit, even though the eggs are not active and becoming, ready to ovulate. The entire ovary itself does get the benefit. But yeah, we see better results when someone does have a cycle.
I see. Okay. And we've already spoken about nutrition. What about sleep? We haven't even touched upon sleep. And I feel like that's something that can absolutely impact.
Absolutely. Adrenal fatigue and insomnia. A typical pattern I see is someone's wired and tired, exhausted all day, but at night they're just counting sheep. They just stare at the ceiling because that's adrenal fatigue and that's cortisol excess. So a lot of times because stress primarily, you're getting a cortisol spike at night when your body's supposed to be resting. Flight, that tiger, the saber-toothed tiger chasing us in our dreams. So acupuncture is wonderful at flipping that and getting your body to go into that parasympathetic state. So yeah, I emphasize quality sleep. And there are things we also encourage like magnesium at night, magnesium glycinate specifically. Melatonin also has shown benefit. So, but really acupuncture, getting your nervous system regulated, and then also watching your diet. Eating too late at night, heavy meals can also influence sleep. But yeah, sleep hygiene is extremely important.
Yes, I agree. And then you touched briefly upon like exercise. I feel like fertility patients, like you see like big ends of the spectrum, right? People who overexercise and they're struggling. And then you're seeing the women who are a little too like very sedentary and struggling. So we need to find that happy medium. So what would you say to a patient that's coming into your office about that?
Yeah, it's exactly right. Yeah, exercise is important, but again, the Goldilocks effect, I call it the Goldilocks effect. You don't want too much, you don't want too little, you want it to be just right. And oftentimes either I have a couch potato or a gym rat and I'm like, no, okay. Because exercise and movement is so important, but not the type of exercise that's going to raise inflammation and put your body, again, in a sympathetic fight or flight state. So exercises like CrossFit or
I knew you were going to say that.
Sorry, I know you're a CrossFitter.
I'm not actually, not anymore.
Oh, you're not? Okay. But you used to be. And listen, I'm all for intense. I love intense exercise personally, but it depends on your life goals. If you're in a time of your life, and I have several patients right now that I'm still biting my lip and saying, stop running marathons and stop with the CrossFit because the statistics show the fertile body fat percentage, you need to be between 18 and 22% body fat to be fertile for women. That's much more than what the Instagram influencers are showing. And so when someone is between 18 and 22, that's a little, you may feel, oh, that's overweight or I'm too curvy, but that is a fertile body. So if your goal in life is to be fertile, then you really have to scale back the exercise to more zone 2 cardio and a balance of walking, zone 2 cardio, and some resistance training. So you maintain
Resistance
muscle
training
tone.
is definitely huge,
Very
not to the
important.
point where they can't move the next day. So that's the piece that I
Yeah.
always counsel women on. Uh,
Yeah. It's important. It's just overexercise is going to be counterproductive for fertility. So
yeah,
you have to decide, do you want to be fit? Or do you want to be firm? Which is, you have to choose, and a balance of that, because again, too much exercise can do damage.
but not moving at all is also doing
But
damage.
yeah, doing nothing at all is very bad for you as well, bad for your fertility. So yeah, that's why it's that sweet spot right in the middle. So I
Yeah.
always encourage walk every day, yoga 2, 3 times a week, lift weights, resistance training once or twice a week. And
I do find just women just feel so overwhelmed by it all with the appointments, they're working, just family obligations. It just becomes so much. So I find if you just tell them to walk after breakfast, lunch, and dinner, if that's all you're doing, great.
that's yeah, that's 80% of it right there is that.
Yeah, absolutely. And
I
then,
am a big fan of yoga. I'm sorry to interrupt. I am a big fan of yoga. I think yoga is a wonderful exercise to throw into the routine
mhm,
because it has so many health benefits for fertility and stress reduction, meditation, but also pelvic area, right? So you're stretching out the pelvic region, which is encouraging blood flow and encouraging circulation.
sure.
So I do encourage once a week, twice a week, do a half hour yoga routine in your basement. You don't have
Yeah.
to go to a studio and pay $30 a session. You can do it in
No,
your
they
video at
don't.
home. You can do
But,
a YouTube
some
video.
women struggle with the accountability piece of things. And then like emotional support, they definitely need I think that's why you brought me on to the practice to get that piece for them. Cause I think, but we encourage women to seek out therapists if they're really struggling and having the support groups. We're running support events now. And I think it's really made a huge difference for women as a whole person, like we talked about earlier, to address those emotional needs. Cause it is a very traumatizing process if you've been struggling for a while.
It is so traumatizing. They estimate that the amount of stress that a woman going through fertility treatment goes through is similar to the PTSD that a soldier comes home from war with. And it's not acknowledged by the doctors. It's like, oh, just take antidepressants, you'll be fine. And it's no, that's it's and the stress, unexpressed emotions get stored in the body.
Yeah.
And unexpressed traumas stored in your tissues. So working through those traumas of everything that could be recurrent losses, can be just failed attempts, just the stress of on the relationship of the trying,
Yeah.
all of that accumulates into this adrenaline and cortisol ball in your body. Talk therapy and just working things out with someone like yourself is so valuable to just express it, let it flow and let it go. That's so important to just get it out of your head because it becomes like a ping pong ball.
Yeah, absolutely. What do you find that are some of the most common questions you get from your fertility patient?
So the questions, oftentimes, if they're brand new, does it hurt? Does it work? Those are the things. How does it work? How does it work? That's a mystery. It's been around for 3,000 years. But regulating of the nervous system, basically, that's the
Yeah.
primary. We talk about chi. Chi, you hear acupuncturists talking about chi, and chi really can be equated to mitochondrial energy of the body and the nervous system and regulation of that nervous system. So that's one of the questions I often get is oftentimes, how soon will it work? It's
Yeah.
managing those
So
expectations.
you're practicing in New York. We're not patient people.
That's the biggest challenge I find is because everybody wants a baby yesterday. And
Yeah.
I understand that. I totally understand that. But to make changes in your physiology takes time. If you change your diet tomorrow or today, if you've been eating junk food for 20 years, you've been eating seed oils, if you've been smoking, if you've been doing all these things and you stop today, cellular regeneration takes, depending on the organ, it can take weeks or months, even years.
We're kind of
So
fighting an uphill battle though, because now there's so many medications that can help with weight loss and all of that. And some women struggling with fertility think it's also their answer to success there. And doing the work is like with the lifestyle changes, that sounds hard to a lot of people, even though it's really not. It's just changing habits where someone wants instant gratification. And that's where they're hoping that we acupuncture might be that for them. And unfortunately, it's not.
and there have been cases where
Right.
I've had patients come in, they tried for a year, 1, 2 months of treatment, one month of treatment, one cycle, and they become pregnant. And that's wow. So we
Yeah.
just tweaked a few supplements, we reduced the stress, we added some proper foods back into the diet, and it was a minor problem that was easily corrected. So
Exactly.
I wish all my cases were that easy. It's just,
Same.
yeah.
Same.
But
So for
we do live in a pop a pill, instant gratification society, which just seems to be getting worse. But
yeah,
having patience and letting your body heal is it takes time. It takes patience.
it does. And it's not that it's not the easiest path, but it's not the most comfortable path, right? Because you have to do a lot of work.
Yeah.
I'm I'm on a pause for my own personal journey, and I have not felt this good since probably 2018 because I wasn't thinking about fertility back then. So this is the first time that and I'm so glad I did this for myself. That's what I say to women. If you're really feeling that awful, just take a minute.
Absolutely. Taking a break is just from the trying it. And I often
And it
tell
doesn't mean you're not actually trying anymore. You're just doing something different that your body needs.
exactly, exactly. Now, there's an interesting phenomena that I often bring up, and I'm actually writing about in my book that I'm almost done with. There are many different mindset approaches. We can attack the problem and really, do everything we could possibly do. But sometimes the harder we try, the more elusive it becomes.
Yeah.
And with the law of attraction, it's you want intention without tension. So if your intention is like, I gotta be pregnant, I gotta be pregnant, I gotta be pregnant, you're creating this negative vibration that's actually repelling your desired goal. And sometimes you just have to allow and give up and stop, not give up,
You're
but
also
keep
treating
trying.
you're treating a generation of women that have been told for their entire life to work harder and achieve. And when we're met with failure, that means we work even harder. So it's changing a lot of learned behaviors.
Yeah. Yeah. And that is, yeah. And it's almost a Zen like philosophy of just allowing it to happen and just and releasing that need or the have to have it.
Yeah.
When you release it and you set that vibration of it'll come, you're creating that vibration that's going to attract as opposed to repel. But it's a hard, and that takes a lot of mental discipline.
It
That takes a
it
lot of time.
does. It
Yeah.
does.
I often tell them when I have a patient who's had IVF and they come to me pre and post, I'll tell them, all right, the 2 week wait, and just surrender to the universe. Because at that point, you've done everything you could possibly do. Just let it go. Just, all right, if any symptoms pop up, if you start going down that negative rabbit hole of, oh my God, I don't know, I don't feel it, I don't feel it, just stop yourself and say, oh, it's up to the universe. It's up to God. It's out of my hands. And just surrender that to the universe because it's really, literally out of your hands completely.
Yeah.
There's nothing
Yeah.
you can do at that point.
Nope. You were very correct in that. So I guess for one of my final questions, what besides letting it go during that 2 week wait, what do you wish every fertility patient knew before starting treatment?
So I want to touch on the 2 week wait for a moment
Okay.
because the 2 week wait is such a big thing and such a stressful, as you and everybody else who's been through it knows. And for the first timers, it really is, wow, a lot more stressful than they anticipated. So I give 3 pieces of advice for really during the 2 week wait. One, I always encourage the old wives' tale of having a little bit of pineapple during your implantation window might help. And it's one of those easy things that the bromelain can potentially help with inflammation, which potentially can help with implantation. So I do encourage that. Why not? A couple of pieces of pineapple core during those 5-day implantation window. It can't hurt. Might as well try that. And it's a lifestyle that seems to be working. So that's the one thing I say. Second thing was guided meditation. So doing a guided meditation of just positively visualizing your outcome. So when you do guided meditation, not regular meditation where you just close your eyes and think of nothing, that's really difficult to do. And that takes years to train your brain. But guided meditation, where you hear somebody's voice painting a picture, a visualization of your desired outcome, that you do that repeatedly, your brain doesn't know the difference between a vivid imagination and reality. And so when you do it often enough, your brain goes, oh, okay, this is real. and starts to act accordingly. So for the 2-week wait, especially if you tend to let your mind get the best of you, I tell them just do it 20 minutes a night. Find a nice guided meditation. YouTube has a million of them. Circle and Bloom is a company I like to use here at house, or Mindful IVF app on the Apple store. All good ways to just control your thinking and just visualize your outcome, your perfect outcome. And then the third thing I recommend is laugh therapy. Laugh therapy is exactly what it sounds like, laughter as medicine. So the power of laughter has been shown that 20 minutes of good, hard laughter is as beneficial as a half an hour of meditation. Because when you truly laugh out loud, your body floods with a cascade of positive hormones like oxytocin that counteract all your stress hormones like adrenaline and cortisol. So during the 2-week wait, I say keep your mood light, watch a lot of comedy. So flood your body with humor. Watch comedy on TV, no horror movies. That puts you into no true crime podcast. That puts your body. So instead, just watch something you know is going to get you to laugh out loud.
Yeah.
When you laugh out loud, your body just goes, oh, okay. And life doesn't seem so serious. And surrender. Practice that surrender of it's up to the universe. It's up to God. It's out of my hands. So those are the 3 things I try and tell people to do during the 2-week wait, and then drink bone broth every day. That's it. That's my bonus one. Is bone broth is a good collagen, and it's a building block of life.
Yeah.
So that's my 2-week wait suggestion, which seems to help. So to answer your last question there was what advice would I give to anybody who's just starting down this journey? Is
Right.
I would say start sooner. If you're a newly married couple, start planning sooner than you think. Because
Yeah.
oftentimes the couples who just get married, we got plenty of time.
That was me.
Yeah. Yeah.
That was
Just
me.
start sooner and just start preconception training, they call that, where get your diet dialed in, get your lifestyles dialed in, exercise, get your testing done, and then spend a good 6 months to a year just planning for not the trying, but the planning of really preparation. So 1, start sooner, and 2, really control mindset as best as you can. Try not to let stress overwhelm you. That's so important.
I agree. Very much so. So I hope that whoever ends up listening to this and maybe they learn something from our conversation today, or if they're feeling discouraged or overwhelmed or afraid to reach out, maybe they have that confidence now after they've learned a little bit from both of us.
Yeah, my final message is acupuncture works. Do it.
Yes, I agree. I've approved that message.
I,
All right. Thank you, Dr. Vitale.
Thank you, Callie, so much. This was a pleasure.
Yes, absolutely.